into this most tedious journey, not a difficult one, just tedious. But we all are capable of understanding the contents of this particular program or position. Sure we are. We have a brain. We could think well. Only we, the individual, or you, the individual, could determine really what it is that you feel, what it is you see. No one sees from behind those eyes but you. So we know that this subject fits within this cosmic order, and that we, being a product of cosmogony or life itself, sure we'll be able to understand things about life when they are presented. So let us go first into the history of medicine. According to the history of medicine, it began in Egypt with Imhotep I. Then it came down to Mr. Hippocrates, and it filtered down to Mr. Claudio Galeno. So with Hippocrates in the year of 365 BC to 1729, Claudio Galeno, the Italian. These three men, Imhotep, Hippocrates, and Claudio Galeno, had something in common. They all used the same substance. They all followed the same platform. They took the same position. Because during that period of time, that time in history, naturally, there were not in existence at that time the chemicals that we are presented with today. They were only plants. But their history shows that they cured every disease known to man. So if this is true, then what happened between that time and now that things seem to be so difficult? Instead of us being useful in eliminating those that are present, new ones are cropping up every day, telling us that, again, the goal line is receding faster than we could run. Could we afford to continue on the path of the past? Why should we take a chance when the past has not served us well? Are we aware of the percentage of elasticity that the body could really admit or even afford? Stretching. How far could we stretch the human body? By stretching we mean stressing the human body to cause it to be in the state of disease. No, we don't know that. We don't know how much we have damaged ourselves because we have not been educated as to what we should have been doing, what we should be eating. We have not been educated in that area. So therefore it becomes very difficult now. But even though difficult, as I said, everything seemed to be easy in deciphering and analyzing once we put into motion that part of us that the philosophers try to deny, the part they call common sense. Common sense tells us that if Hippocrates, Imhotep, and Claudio Galeno, not necessarily in that order, but the three men used herbs and that they were successful in reversing disease, what happened now? Not only have we failed as far as being effective in helping others, to relieve themselves of disease, we have compounded and added to it using the herbs that we are using. What do I mean? It seems to be a contradiction. Because if Mr. Imhotep I, Claudio Galeno, and Hippocrates use herbs, and herbalists today are using herbs, why aren't they as successful as Claudio Galeno and the rest? That is the common sense part of it. If they cure, we should. Why aren't we? Well, we were removed from the rhythm of life. We were removed from the path that helps us understand those things that are natural from those things that are unnatural. Because if those three doctors used these herbs 2,000 years ago and were successful, we in modern times should be even more successful than they were. Because we always attribute time and development, science, to knowledge. But the fact of the matter is, we are falling short. We are falling short because the herbs that Imhotep, Hippocrates, and Galeno used are not the herbs that are being considered today.